Ladies and gentlemen, opposition sides stand here for preserving human life quality and advancing scientific research. We'll be addressing three main arguments. The first two, which I'll be addressing, are the importance of human embryonic stem cells in developing life quality, and how this furthers your knowledge of genetics. Afterwards, my teammate Antonio will talk about how these speeds up medical and scientific breakthroughs. But first, I would like to make some rebuttals on some of the points that proposition side said. There were a few things that we actually agreed on proposition side. Actually, nothing besides that masturbation and experimenting is fun. But we would like to tell proposition side that their idea of an embryo is actually incorrect, as they are groups of cells before implantation, which happens at 10 days during the pregnancy. However, we are going to go by your definition, even if it is incorrect. There was a huge assumption of proposition side's whole argument, that the assumption that embryos are alive. How can we tell that something is alive when, at 3 months, they have no neurological connections, and so they do not feel anything physical or emotional, which I believe are the important conveyors of whether something is alive. In the same way you mentioned how we should experiment with someone with a vegetative state. Well, first of all, they may have already had social connections, and they already have neurological connections, and therefore they are not just a group of cells, ladies and gentlemen. You also talked about women crying about miscarriages. Well, in that case, the embryo, the future pregnancy, is wanted, ladies and gentlemen. As I already said, in vitro, we are talking about masturbating into a cup for the law of science, not for making a baby out of love. No, thank you, sir. Hence, there isn't really a lot of emotions going into this, because masturbating into a cup is not the same thing as two people falling in love and wanting to have a baby and then miscarrying the baby. Here, there is no want to have a baby. It is done for entirely scientific purposes. No, thank you, madam. In the same way, talking about people getting desperate to get pregnant, well, these kinds of doctors should continue to exist. We're not throwing their embryos away. We're throwing people's sperm and eggs who do not want to have a baby but want to help science. Moving on to my first argument, the importance of human embryonic stem cells. Ladies and gentlemen, within this group of cells that we call embryos, there exists human embryonic stem cells. These are one of the major scientific breakthroughs of the past years. Why? Because they are able to ameliorate the quality of life of human beings, ladies and gentlemen. But what are these? These are undifferentiated cells. This means that they are wild card cells, which can adapt to their surroundings. And in this way, by putting them, say, in a pancreas, they are able to repair damaged cells and restore the patient's organs. What does this do, ladies and gentlemen? It helps life quality, as in my next example. In 2006, in Britain, there were people who were treated with human embryonic stem cells. These people had chronic diabetes. These people had to suffer 3 times a day, insulin shots, ladies and gentlemen. They did not have a good quality of life. They weren't able to keep on living their normal life. But through this process, they no longer needed insulin, and their pancreas was restored, and in this way they were able to return to normal life, hence increasing their life quality. Shouldn't we protect a human being's life quality as opposed to the so-called life of a group of cells? Yes, sir.
We can protect it by making compulsory the donation of organs, as in Spain, in which we will save thousands of lives.
Thank you, sir. Well, some of these are actually not able to be restored through organ donation. For example, in children with leukemia, they may have to repair their broken spinal cords. Trying to get a donation of these cords needs a live patient, ladies and gentlemen, which means that someone must have to go through an extremely painful process of removing material from the spinal cord in order to give this transplant, ladies and gentlemen. No, thank you, sir. I believe it is easier to use these stem cells from these things that we call embryos, these group of cells which do not breathe, do not speak, do not have neurological connections or emotional connections. In the same way, how can we say, as proposition side say, that we are saying that killing a child is wrong? Well, no, ladies and gentlemen. This is exactly what we are advocating against. We believe that getting rid of a few cells is okay because it means saving the life of a child. Saving the life of a child who has leukemia and who is going to die if they do not undergo treatment against their leukemia, which can be attained through human embryonic stem cells, ladies and gentlemen. How can we say that having the proper technology to do so, that not preventing a child's death is ethical, ladies and gentlemen? Moving on to my second argument, the furthering our knowledge of genetics. Ladies and gentlemen, these group of cells, being in their most primitive basis, are the key to understanding genetics. And why do we need to understand genetics? You say, well, this knowledge is for the utmost importance for the advancement of medical breakthroughs. Why? Because in this way we are able to understand the genetic implications of diseases. And by understanding their genetic implications, we are able to prevent them and maybe cure them, ladies and gentlemen. We'll be able to prevent horrible chronic genetic diseases from occurring in our society. Let's take, for example, Huntington's disease. The genetic implications of Huntington's disease and in what section of the human genome it is found was discovered thanks to investigations in human embryos, ladies and gentlemen. So thank you, sir. Huntington's disease is a horrible disease in which people lose control of their limbs and are therefore not able to carry out a normal life. They are dead by the age of 40, ladies and gentlemen. By understanding the genetic implications of this disease, we are able to prevent it, and by preventing it through genetic manipulation, we are hence able to find a cure. As by knowing where it is in the human genome, we will know exactly what sort of genetic manipulations we need in order to prevent this disease from continuing from happening. Other diseases, such as Tay-Sachs disease, which kills 1-year-old babies, can also be prevented through human manipulation. Ladies and gentlemen, we know how it happens. We know how it happens thanks to our knowledge of genetics from human embryos, ladies and gentlemen. And by knowing how it happens, we'll be able to prevent them, and in this way, save human life and improve the life quality of human beings, ladies and gentlemen. Who says that through genetic manipulation we will not be able to prevent horrible genetic diseases such as cancer? Who says that lying within the genetic map of these embryos will not find a cure for incurable cancers, ladies and gentlemen? We believe that it is worth a try. It is impossible for these sorts of investigations to be carried out with the motion presented by the proposition side, as they would be completely putting a barrier on the development of these medical investigations. It is for these reasons that I beg this House to oppose this motion. Thank you very much.